Okay, welcome. We're very glad to have you joining us today. My name is Angie Bridenstine. I'm an assistant professor at Tulane Institute for Infant and Early Childhood Mental Health, and I'm happy to be introducing our webinar today. This is part of our In Dialogue series, which is a partnership between the Louisiana Children's Museum and the Tulane Institute of Infant and Early Childhood Mental Health. And the team at the museum is working every day to bring new ways to interact with topics that are important to parents and families in our community. So today we are going to be discussing helping your children as we navigate school reopening during the COVID-19 pandemic. So I'm happy to introduce our speakers today, who are Dr. Bianca Watson and Dr. Mio Thuy Mint. Bianca Watson is a second-year general psychiatry resident at the Tulane University School of Medicine. And Dr. Mint is a board-certified pediatrician, adult, child, and adolescent psychiatrist, and a faculty member at Tulane. He is interested in medical education, LGBTQ health, and advocacy. He is a leader in the American Academy of Child and Adolescent Psychiatry and a member of American Academy of Pediatrics, American Medical Association, and Louisiana State Medical Society. So I just want to let you all know that our webinar is being recorded and it will be shared later on the museum website and YouTube channel. And at the end of the presentation, we will open up our webinar for a Q&A. So if you have any questions throughout the presentation, please feel free to submit them using the Q&A button that you'll find at the bottom of your screen. And there are some thunderstorms rolling through the area, so if we suddenly disappear, I hope that won't happen, but it would be because of power outages. But hopefully we will make this through just fine. So I'd like to turn things over now to Dr. Mint and Dr. Watson.
Hello, everybody. Thank you so much for coming to our presentation. We are so excited to be here and discuss this very important topic of school reopening with you. And before we dive into our talk, I would really like to emphasize that every family's situation and circumstances are so different. And this presentation is not intended to suggest what you should or shouldn't do for your child and your family as schools reopen, whether this is virtually or in person. This presentation is really intended to equip you with information and expert recommendations on the topic of school reopening, so that way you can make the best choices for your family and maximize safety in the process. We hope that you find it informative and helpful. So we are still learning more about the coronavirus, and so many things in our life have changed. And in a typical year, nearly 2/3 of the nation's 50 million public school children would have returned to their classrooms by now, which is the third week of August. And this year is obviously very different due to the coronavirus pandemic, with individual districts largely being left to chart their own paths, whether this is the return to the classroom, remote learning, or a mix of the two. The return to school can be extremely anxiety-provoking for so many families. And in June, the New Orleans Public Schools actually launched a public education survey in which over 7,000 people participated. And the number one concern among parents, students, educators, and community members in regards to school reopening was minimizing health risks among students and staff. And I'd imagine so many of you have questions about what in-person school may look like, how specifically to promote safety for your children, and the impact of this pandemic on their educational experience. When in doubt about what to do or what to expect, it's always helpful to turn to the experts and look at their guidelines and recommendations to best understand our options. Fortunately, I've spent lots of time looking into these guidelines for this transition, and I've synthesized the key points to share with you today. The key topics that we'll be talking about are the importance of school, strategies to reduce spread of the virus, screening and testing procedures, and the importance of promoting positive physical health as well as mental wellness. We will be discussing the current guidelines from both local and national organizations, including the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Louisiana Department of Education for school reopening during the COVID-19 pandemic. We will also discuss current reopening plans for Orleans Parish public schools and end with a few practical tips as we navigate this transition. These guidelines and reopening plans very well may change as we learn more. So these are the current recommendations as of this week. I wanted to start this presentation by talking about why school is important. And school is important because schools promote child and adolescent development and well-being, as well as providing our children and adolescents with academic instruction. Schools also teach children social skills, emotional and mental wellness, safety, reliable nutrition, and provide opportunities for physical activity and socialization. For many families, school is where kids get healthy meals, access to the internet, and access to other vital services they otherwise would not be able to access. Schools also help reduce racial, ethnic, and economic disparities and provide supervision of children while family members are at work. I wanted to talk about how education may be changed due to this pandemic. And as many of you have heard on the news or from your children's schools, there have been discussions of a completely virtual education, hybrid models, which is a mix of virtual or online education and in-person education, as well as entirely in-person instruction. Most of what I'm focusing on is in regards to in-person instruction. However, many of the information and tips in this talk would also be relevant for virtual schooling. Based on the current information, pediatricians strongly advocate that all policy considerations for the coming school year should start with the goal of having students physically present in school unless required to stay home in order to adhere to local public health mandates or because of unique medical needs. The child psychiatrists discuss how public health agencies must make recommendations about returning to school in the classroom based on scientific evidence and local community circumstances, with careful and thoughtful decision-making and with the best interest of students, teachers, and staff in mind. Politics should not play into these decisions, and to maximize the safety for our children, there very well may need to be changes in school infrastructure. Examples of this include increased spaces or touchless sinks, and there may need to be changes in staffing to decrease the student-to-teacher ratios. One size cannot fit all, and pediatricians, families, and schools should partner together to collaboratively identify and develop accommodations when needed for families on a case-by-case basis. When classroom-based education is not possible, the guidelines suggest techniques that optimize social interactions alongside educational objectives should be prioritized. Additionally, the pediatricians emphasize that we should anticipate some impact from lost instructional time and social emotional development on children and adolescents. Schools will need to be prepared to adjust their curriculum and instructional practices accordingly, and they should expect ongoing distress of educators and students that will require extra support. Regardless of how school looks this year, it's truly critical to maintain a balanced curriculum with continued physical education and other learning experiences, rather than an exclusive emphasis on the core subject areas. As we discuss ways to keep our children safe, it's important to understand how COVID is thought to impact children specifically. The current guidelines are based on what pediatricians and infectious disease specialists know about COVID-19 in kids. Children infected with the virus may have many or few non-specific symptoms, or they may be completely asymptomatic. The most common symptoms in children are cough or fever, although there can be many other symptoms such as fatigue, headache, diarrhea, nausea, loss of taste or smell, among others. And there's increasing evidence that some racial and ethnic minority groups are being disproportionately affected by COVID-19. Latino and African American residents of the United States, for example, have been approximately 3 times as likely to become infected as their white neighbors. Evidence so far suggests children and adolescents are less likely to become infected or spread the virus. While children comprise 22% of the US population, recent data shows that 7.3% of all cases of COVID-19 in the United States reported to the CDC were among children. At this time, it also appears that severe illness due to COVID-19 is less likely among children. Looking at the data from the states, children were 0 to 0.4% of all COVID-19 deaths, with 19 states reporting 0 child deaths. And additionally, in the states that reported this statistic, 0 to 0.5% of all child COVID-19 cases resulted in deaths. So as you can see, less than 1% for both those statistics. And as you can see from the accompanying graphic, Louisiana is in around the upper middle for cumulative reported COVID-19 cases in children. Now we're going to talk about ways to keep safe or reduce risk of spread of the virus, since this is a very, very common and important concern. Per the child psychiatrist, the return to school must include appropriate protections for all children's, families, school personnel, and other members of the community. We are going to discuss tools and techniques to minimize exposure and spread of the virus. We acknowledge that these may be challenging for many children, but it's so important to model and teach these behaviors to maximize safety. Two important ways to stay safe include hand hygiene and wearing masks. In regards to masks, children under 2 years and anyone who is currently having trouble breathing or is unconscious, incapacitated, or otherwise unable to remove a face covering without assistance should not wear cloth face coverings. Everybody else should wear some sort of facial covering and really try to minimize touching their mouth and noses. Hands should be washed with soap and water or alcohol-based hand rub for at least 20 seconds when visibly soiled, before eating and after using the restroom. Other ways that we can keep our children and ourselves safe include these additional measures: cleaning and disinfection, considering reduced class sizes, having our teachers move the classrooms and not students, leaving doors open to reduce exposure to high-touch surfaces like doorknobs, and considering having students eat lunch at their desks. The guidelines also discuss students with special needs. The needs of an individual child in regards to safety measures may require creative solutions, often on a case-by-case basis. This is again important to discuss with your pediatrician as well as with your child. Another way that we can stay safe is via physical distancing. Physical distancing, sometimes referred to as social distancing, is simply the act of keeping people separated with the goal of limiting spread of an illness between individuals. It is fundamental to lowering the risk of spread of COVID, as the primary mode of transmission is through respiratory droplets by persons in close proximity. The goal should be to stay at least 6 feet apart, especially for adults to help virus. However, spacing desks at least 3 feet apart for children and avoiding close contact may have similar benefits for students, especially if the students are wearing cloth face coverings and do not have symptoms of illness. When possible, outdoor spaces can be used for instruction and meals. Students should also have extra space to spread out during activities like exercising and singing. And teachers should minimize exposure to other adults and do as much virtually as possible when interacting with other adults and staff. The guidelines also discuss safety in crowded spaces, such as while students are on the bus, in the hallways, or on the playground. Since these are often very crowded spaces, schools can give bus riders assigned seats and require them to wear cloth face coverings while on the bus, and encourage students who have other ways to get to school to consider using those options, again remembering that this may not be an option for all students. At school, we can also mark hallways and stairs with one-way arrows on the floor to cut down on crowding. Outdoor activities are also encouraged, so students should be allowed to use the playgrounds in small groups. And as we've discussed, many of our schools have resource limitations that make it difficult to reduce crowding. And this is why it's so important as a parent and community member, regardless of our own personal situation or our own personal circumstances, we must advocate for equity and justice and investment in our schools. So next, I would like to talk about screening. So the guidelines suggest that school policies regarding temperature screening and temperature checks must balance the practicality of performing these screening procedures for large numbers of students and staff with the information that we know about how children manifest COVID-19 infection, the risk of transmission in schools, as well as the possible lost instructional time to conduct all these screenings. The main thing really emphasized by the guidelines is just the need for some sort of school policy in regards to screening. And screening is usually done by a combination of temperature checks and asking about symptoms. Guidelines suggest various methods for screening at home prior to daily school arrival, including using systems or online reporting. But again, this may not be practical for all families. Schools should develop plans if a student or staff member has a fever, either before arrival to school or once they arrive at school. Sick individuals should stay at home. I acknowledge how difficult this is, both for children and their caregivers, as many adults don't have paid sick leave. This is definitely an issue we should be aware of and consider advocating for on a greater scale, so that those who need to quarantine for the safety of themselves as well as the others around them can do this without potentially catastrophic repercussions. Now moving to talking about testing. Testing for this virus is an important public health strategy to limit the spread. However, testing all students for COVID infection prior to the start of school is not feasible in most settings at this time, and it's unclear if it really would reduce spread in schools, especially since someone could have a negative test at one point and be positive shortly after. There are currently two main tests, the nasal swab viral RNA test and an antibody blood test. Generally, the nasal swab test is used to determine if someone has an active infection, and the antibody blood test is used to determine if someone may have previously been infected. We know a lot more about the nasal swab test, and the guidelines currently do not recommend making any decisions based on the antibody blood test, especially in regards to school attendance. If a student or school staff member does have a known exposure to COVID-19 or has symptoms of this virus, having a negative virologic test result, according to the CDC guidelines, may be warranted for local health authorities to make recommendations regarding contact tracing and/or school exclusion or school closure. Additionally, there should be personal protective equipment available as needed on site at all schools. Next slide. Okay, so talking about checkups and vaccination. It is important to stay up to date with checkups for our children. We really encourage you to schedule appointments for checkups, especially ones that may have been delayed due to the pandemic. Checkups monitor both a child's physical and social and emotional development. Many children are suffering from anxiety, increased stress, and other mental health issues from this pandemic. Pediatricians can screen, provide preventative measures, and intervene, treat, and refer when needed. Additionally, the existing school immunization requirement should be maintained and not deferred because of the current pandemic. Although the flu vaccine is generally not required for school attendance, in this coming academic year, it should be highly encouraged for all students, and school districts should consider requiring the flu vaccination for all of its staff members. Talking more about mental and emotional health. Child psychiatry guidelines state that the mental health of students must be continuously addressed because mental health is an intrinsic part of overall health and well-being. This includes the opportunity for mental health care both for children and for all educators, school staff, as well as many of the parents who are helping teach children at home. The emotional impact of this pandemic, financial and employment concerns, social isolation, and growing concerns about systemic racial inequality, coupled with prolonged limited access to critical school-based mental health care services and the support and assistance of school professionals, demands careful attention and planning in regards to mental health. All necessary components must be in place to ensure effective systems for the early identification of and intervention for the increased number of high-risk students, staff, and families as a result of this pandemic. Now I'm going to discuss some of the local plans and guidelines. As many of you know, currently in-person instruction is delayed until after Labor Day at public schools in this area, with many beginning the year with virtual learning. As discussed, virtual learning may be difficult for many families due to lack of resources or social circumstances. For those students who may need assistance with access to virtual learning, especially due to technology gaps, there are some partnerships in place. One of these is between the Mayor's Office of Youth and Families and the New Orleans Recreation Development Commission and the New Orleans Public Library. And this partnership is for community learning hubs that will provide families with safe spaces for children to engage in supervised independent virtual learning and support families that need access to internet services. Additionally, at the start of the COVID-19 outbreak in New Orleans, the New Orleans Public Schools quickly acquired 10,000 laptops and 8,000 Wi-Fi hotspots. There are also local internet providers offering reduced internet rates to families to try to help improve distance learning for Orleans Parish public school students. As you can see in the graphic on this slide, NOLA Public Schools have proposed different plans depending on the community phase that we are in. It's really important to note this plan was developed to be flexible. Learning can quickly be transitioned to virtual if the local health situation necessitates it. We are currently in phase 2, which calls for fully in-person learning for kindergarten through 4th grade and hybrid model for 5th grade through 12th grade. Both currently, as well as when schools physically reopen, local guidelines limit after-school activities with no contact sports until stage 3 of the local reopening guidelines. It is important to keep an eye on the news and any communication with your children's school over the coming weeks to stay up to date as the local pandemic situation changes. Wanted to comment about talking to your child about this issue. So there have been several presentations through the In Dialogue series with tips and recommendations for discussing difficult topics such as COVID-19 with your child. There will actually also be a presentation next week for discussing this school reopening with your child and with lots of tips to help them cope with this transition. But briefly, it's really important to take some dedicated time to sit down with your children and discuss this transition so that way they can be prepared. And it's important to maintain as much of a routine and normalcy as possible. And it's important to discuss with them both what virtual and in-person learning might look like in the coming months, as well as how to stay safe during this time using many of the tips that we've discussed. Additionally, I wanted to give some practical tips for this adjustment. As we've discussed, this is such a stressful and difficult time for so many families. Self-care for both students and their families is paramount. As you can see on this slide, there are some practical tips listed here. Key ones that I found extremely helpful include promoting self-awareness and articulating our feelings. It's very important just to talk about how we are feeling. I also think that promoting social interaction of our children, even if it's virtual or socially distanced, is so important for mental health and development. Finally, I think that cultivating new hobbies and interests is important during this time. Children often look to us and model our behavior, so it's important as adults that we set positive examples for them. And it's okay for us to seek help when needed, so that way we can be the best caretakers and role models for our children. I wanted to mention a few great national resources to read up more about the guidelines that we've discussed in this presentation, as well as to stay up to date of any changes or new recommendations as they come out. So healthychildren.org by the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Center for Disease Control are all wonderful national resources to look into. I also wanted to mention some wonderful local resources to learn more about local guidelines and local plans. So these include the Louisiana Department of Education, Partners for Family Health Louisiana, as well as NOLA Ready. Okay. We now wanted to open up this presentation if anybody has any questions about things that we talked about or ways to navigate this difficult transition.
Thank you so much. This information is extremely helpful. And we do have a question that has come in through the Q&A feature, so I will read that in a moment. And I also just want to invite anyone listening to go ahead. If you have additional questions, please use the Q&A button at the bottom of your screen to type those questions in, and I'll be happy to read them to our presenters. So the first question we received is an excellent question. And the person is asking if there are multi-person desks, which are common in pre-K and kindergarten classrooms, are plexiglass dividers as effective as physical spacing?
So I actually haven't read a lot about that. I don't know if Dr. Mitt has thoughts on that.
Sure. So the plexiglass definitely is a important barrier, because when we actually think about the physical distancing and the wearing masks, we want to actually create a barrier for the particles, the respiratory droplets, to actually transmit from one person to another. So plexiglasses are actually a great way to prevent the spread of the virus. For their discussion about, would it be better if we have a plexiglasses and some spacing? Of course, that would be better, but plexiglass will actually prevent the droplet from getting to one from another. The important is that the school and the classroom is regularly cleaning them. Because if, for example, a child is spit onto the plexiglass, right, and that sort of bodily fluid is there, there's an opportunity for another person to actually touch it. We know more about the viruses on the surface. Is actually not as transmissible as once we thought at the beginning of the pandemic. So the primary mode of transmission now, as we understanding, is the respiratory, which is why the universal masking is a really important factor, as well as the physical distancing, and that's include, of course, putting the plexiglass like physical divider, so that these droplets won't transfer one another.
Thank you very much for answering that question. One additional question is, if a parent feels like the school or the classroom teacher is not following the guidelines or not enforcing safety guidelines the way they are anticipating, do you have any suggestions about what the parent might do or who they might speak to about that if they have concerns?
So, I mean, my thought would be probably contacting the school leadership and really just detailing your specific concerns and seeing kind of how they respond to that and what the different options that they come up with to address those concerns. And I do think, most schools are trying to be very flexible during this time, and they understand that every child's situation is different and every family situation is different. And so, you can always talk to them. I know maybe not in Orleans Parish or maybe in different places, they're giving people choices as well if they want to do virtual or in school. And ultimately, if you really feel that it's just completely unsafe for your child, you could talk about trying to move to a more virtual or hybrid model in the meantime, so that way they can make the changes that you've discussed with them. So that would be my thought for that question.
It's really also important to know that pretty much everybody is stressed. This pandemic, as well as all the other stressors, been hitting hard to all the adults as well as children. So that the teacher actually maybe, and the school leadership may be trying really hard. And so try to actually have a dialogue and then see, do they actually have resources? And that include, the physical resources of cleaning supplies and the barrier, as well as a human power support. Do they have enough staff and the crew to actually deliver what they're hoping to deliver? Or it just a mental supports for those educators and administrator that are available. So I think all of those are really helpful to have a dialogue. Dr. Watson's have mentioned, if you feel like you're not getting an appropriate response, definitely taking up with the leadership, and progressively, and looking into other advocacy resources, like Families Helping Families are a great community resource in the education arena, and that can actually help promote. And figuring out your child's specific needs with your pediatricians and mental health clinicians, therapists, child psychiatrists, just to see what is it that each child is needing, as well as for the community. I think those are all important to keep in mind.
Thank you. Again, if anyone has any additional questions, please go ahead and type those in the Q&A feature. But one question is, do you have any tips for parents who might be feeling anxious about having their children going back into the classroom, even with the precautions in place, just kind of for managing that uncertainty and anxiety?
Yeah, so I think, like we talked about, this is a difficult time for everybody. So I think just acknowledging that from the get-go, that you are not alone in this struggle, I think can be incredibly helpful. I also think just really connecting to others and trying to find support. So whether that's talking to other family members, talking to other parents in your community, talking to your neighbors, just talking to people about how you're feeling is incredibly therapeutic and really might ease, some of the anxieties and fears and worries that we have. And like we've mentioned, if it is something that is truly extremely distressing to you, you can always reach out to a therapist, a psychologist, a psychiatrist. anybody like that to get help, and that is totally okay. There are so many of us here in the community that would love to help you navigate this transition, so just don't be afraid to ask for help if you really need it.
In addition to that, your primary care clinicians can be a first step resource if you don't know where to start, if you need to actually reach out to the mental health clinicians, as Dr. Watson has mentioned. And I actually put the slides back about the practical tips. The modeling is a really important key for our children's. And so if we are actually stressed out, taking actually time to care for ourselves would really beneficial to help our children as well. So, practicing things together, you might find it actually helpful for yourself as well.
Thank you so much. Well, I don't think we have any other questions at this time. So I just want to remind everybody that this recording, as well as past and future recordings, will be on the Louisiana Children's Museum YouTube channel. And I've posted a link to that in our chat box. And there is a short link here that if you wish to follow this or type this into your phone or device, it gives you an opportunity to give some feedback on today's webinar, as well as any thoughts about future webinars or topics you may be interested in. So we would welcome your feedback and take that into consideration in planning for future talks. And again, thank you, Dr. Watson. Thank you, Dr. Mint, for your time and sharing your expertise and all this incredible information. And thank you, everybody who joined. We appreciate having you here today.
Thank you.
Thank you.